Good afternoon. My name is Jason Ball and I'm a respiratory therapist, and I deal with the education and treatment of patients with pulmonary or lung issues. Now you're probably wondering, why am I dressed in this surgical outfit in this ICU room talking to you today? Well, the reason is I'm here to talk to you about a very important topic: current strategies in smoking cessation. You see, I think it's important we talk about that, since cigarette smoking causes approximately 480,000 deaths each year. Cigarette smoking is probably the leading cause of the most widely known killer in America, cancer. 18 out of every 100 adults currently are cigarette smokers. It's staggering. And there's about $170 billion a year that's spent on healthcare related costs because of cigarette smoking. So as you can see, it's a national problem, but more importantly, it's one we ought to take to our own heart, one we ought to take serious to quit in order to help improve our health and live a longer, healthier, productive life. Now, I think it's important when talking about cigarette smoking that we discuss what nicotine exactly is, because nicotine is the drug that actually causes the addiction and keeps us just so wrapped up into smoking that we're not able to break the ties of it, so to speak. Now, nicotine, like I said, is a drug, and nicotine works by stimulating the receptors inside the brain that release a substance called dopamine. Now, dopamine is a substance that, when released, causes a euphoric feeling within us. So what happens is we smoke a cigarette, nicotine gets into our bloodstream, nicotine runs to the receptor site, hits the receptor site, dopamine is released, and we get this, it's just what I need feeling, happiness, well-being, just euphoria. Problem with that is, if you don't ingest or smoke another cigarette in a few hours, you start having withdrawal symptoms because your body's saying, hey, hold on a minute, that nicotine was good, it released that dopamine, I need more of that. If you don't get it, the withdrawals come on. Withdrawals bring unwanted symptoms such as depression, anxiety, stress, increased heart rate, which leads to you picking up another cigarette, smoking a cigarette to relax all those symptoms down. So the cycle never ends. It's a repeating cycle, and before you know it, you're smoking a pack or two a day. Now, that's what's going to cause your increased health problems, your cancer, your asthma, your emphysema. So the chain just doesn't get broken. So in order to help break that chain, it's important that we talk about ways to prevent it or help you quit smoking. First off, we can talk about counseling. Now, counseling has got a couple of different options that can go under that heading, so to speak. You can have physician counseling, you can have group counseling, or you can just have telephone counseling. Now, the best thing to do when starting any nicotine replacement therapy or smoking cessation program is talk with the healthcare provider first. Let them do a thorough examination. Let them talk to you and see what the best fit for you would be. Group counseling obviously is for somebody that might be a little bit weaker as far as quitting on their own, and they need the extra push from people to kind of encourage them about their way. It's great. Point being, some type of counseling is going to make it so much more effective for you to quit smoking than just trying to do it cold turkey on your own. Now, along with counseling, of course, we have the medications that can be prescribed to help you quit smoking. And no, it's not a pill you're going to pop, which so many people think, and all of a sudden, boom, you're going to quit smoking tomorrow. Don't work like that. They help you cope with the withdrawal symptoms along the process of quitting. Now, there's two different categories of medication. One is a antidepressant category, which is a medication commonly prescribed called Zyban. Now, how Zyban works, you take the medication helps reduce the symptoms associated with the withdrawal process. So it's going to help with the with the depression. It's going to help with the anxiety. It's going to help with the increased heart rate. It's going to help with the cravings, the symptoms associated with the withdrawal. The other classification of medications is really, really good, is the actual nicotine receptor inhibitors. Now, this would be a medicine such as Chantix. Now, what that does is when you take that medication and it floats through the body, it actually blocks the receptors that the nicotine is targeting. So if you block the receptor, the nicotine can't get in, the dopamine back here is not released, there's no euphoric feeling. So you take that medication over a couple months, taper your nicotine levels down that you're ingesting, and it ultimately helps you quit smoking. The medication and the counseling and nicotine replacement therapy used in combination produces tremendous quit rates. But they all need to really be used in combination with one another in order to help you achieve the best quit rate. The other type of therapy to quit smoking that is used is your nicotine replacement therapies, or NRTs as they're commonly called. Nicotine replacement therapy can come in several different forms, and we'll discuss each one of them, and I'll run over some disadvantages and advantages to it, just to kind of educate you real briefly on those. Your first type of nicotine replacement therapy we can talk about is your patches. Your patches obviously work by being applied to your skin, and transdermally through the skin release nicotine doses. So usually they start off at a preset higher dose, taper that dose down over several weeks to where that you ultimately don't need or don't crave the nicotine anymore. Now the advantages is it's very convenient. Open the patch, stick it on your arm, you get the nicotine through your skin. Readily available. You just run to the pharmacy and pick it up. You can buy it over the counter at most pharmacies. So it's very easy to start getting use out of. Disadvantages, it can cause some skin irritation, and all of these nicotine replacement therapies, you can have some side effects of the actual nicotine. The other type of nicotine replacement therapy is gum. Now the gum is even easier than the patches. You just buy the pack of gum, pop the gum in, chomp on it a little bit, and the nicotine is released in the oral mucosa, which is just an immediate response, immediate reaction to the nicotine. It's dispersed into your body, goes right to the receptors, the craving is eliminated. There again, you chew the gum, decrease the doses over several weeks until hopefully you're nicotine free. You're not dependent on that. Nicotine inhalers is another replacement therapy that fall in this category, and basically they work like a little Vicks Vapo inhaler, about the size of a tube of chapstick. And it has nicotine inside there. You put it into your nostril, whiff it in, and the nicotine is released in the nasal mucosa, and you get an immediate effect there from that as well. The nicotine replacement therapy, the medication, and the counseling, as I said earlier, used in combination produces tremendous results because the nicotine is being released into your body. The medication has helped to eliminate some of the withdrawals associated with the nicotine elimination process, and the counseling just kind of helps give moral support and gentle pushes on you to encourage you to keep on your course and quit smoking. One other area I want to mention about is vaping. Since it deals with smoking and it's become very, very popular in mainstream culture here, vaping is actually the little pipe that they put a solution in, and vaping actually means inhaling water vapor. So it's a water vapor you see these people smoking in. Now, the water vapor can have nicotine in it, or it can be nicotine free, and it's the same pretense as what the nicotine replacement therapy is. You start off with a set dose of nicotine, taper it down to where you're ultimately not using it anymore. One of the big advantages is the vaping is, besides the taper and the doses of nicotine, is you actually have something in your hand that you're smoking, which kind of gives most people the hand-to-mouth fixation that they have. It helps eliminate that they can taper off of it. Some of the side effects is, I mean, you're still inhaling a substance that's supposedly supposed to be clean and sterile and safe. However, through the actual process of the vaping mechanism, creating the water vapor, it's almost like an atomizer that's atomizing a solution. You can inhale some metalloids from the little rings and stuff inside there, so people could be allergic to that. Possibly could cause cancer. We don't know yet. It's not been out long enough for actually to do too many studies on it to see if there's any, severe side effects from it. So that's kind of, the jury's still out on that one. So I think the most important thing is you should try to stick with the stuff that's tried and true. Your nicotine replacement therapy, either your patches, your gum, your lozenges, or your inhalers. Your medicinal treatments, such as your Chantix or your Zyban, your antidepressants, or your nicotine receptor inhibitors, and combine that with good sound counseling, and chances are you're going to want to be able to quit and going about your business, your life, and just have an improved quality of health. In summary, cigarette smoking is the leading cause of disease and death in the U.S., with over $170 billion being spent annually on healthcare costs associated with it. Smoking cessation can reduce your risk to acquire cancer, heart problems, and many other diseases that's associated with smoking. financial gains associated with smoking cessation is just astronomical as well, especially with cigarettes approaching $6 a pack. One can see very quickly how that could be a great benefit from it, because if you smoke a pack a day, I mean, you're talking $150, $180 a month just on cigarettes. It's an expensive habit to have, to cause you harm, to cause more medical expenses, and potentially kill yourself. Best advice: quit smoking. Speak to your healthcare provider. Google on the internet smoking cessation programs. A plethora of information will come up for you to click on, to go on, phone numbers. Many non-profit organizations offer counseling in the area for free. It's something that needs to be done. It's something you need to be done for you, for your family, for society in general. So I hope this video helped. Maybe it'll give you a little nudge to point you in the right direction to help you quit smoking, or give you the urge to just start, whatever the case may be. Good luck on your journey in smoking cessation. Have a good day.